let's jump into some segments. So first off, this first segment is actually very, very important because it involves breast cancer, which obviously is a very big topic here in the United States and across the whole world, in fact. And this one is an important update to the guidelines for breast cancer screening. So this past week, the U.S. Preventative Services Task Force, USPSTF, which I think they should come up with a better name because that's like super long, I can barely remember it, finalized some new recommendations for breast cancer screening. Okay. And so the USPSTF is one of the major organizations that makes cancer screening recommendations. They're one of the bigger ones. There's a few out there that do both breast cancer and other type of cancer recommendations. And all of these people, all of these organizations are looking at research on the topic to determine, okay, what is the recommendation for this particular cancer as far as screening and whatnot. And so from 2009 until now, the USPSTF had been recommending that for people with average risk of breast cancer, so not people with very high risk, but just your average run-of-the-mill woman, should get mammograms every other year starting at age 50. Okay? So that's the important thing, 50. So now, after reviewing more recent literature, the USPSTF is recommending that women start mammograms at 40. So they've dropped it a whole 10 years. And to be fair, a lot of organizations had already kind of come to that conclusion that either women at 40 should consider it, or women at 40 should talk to their doctor. Mm-hmm. And now the pendulum is shifting a bit towards that at 40, all women should get mammograms. Of note, they didn't change the frequency, because that's also up for debate, is how often should you get your mammograms? Should you do them yearly, which is what a lot of people recommend, or should you do them every other year?
I'm sure it has to do with like when your relatives have history of breast cancer.
For sure.
That determines when your doctor's like, okay, let's start this.
Yeah, absolutely. I mean, definitely for people that have a significant family history, these guidelines change.
Yeah, so my grandmother had breast cancer.
Did she get it when she was older or younger?
Older.
Older, okay.
Yeah.
So that, if she's the only one, that probably would still put you in the average risk category. Now, if she had gotten it at
early
45, or if she'd gotten it but also had a sister that got it, and then you maybe had an aunt that got it, then that would be notable, and you would probably be in a little bit higher risk. And people probably wonder, okay, so why is there not a consensus for this? Yeah. Well, it's because there's actually several groups out there that are looking at this data, and everybody interprets data differently, and so it's hard to get two people to agree on something. And here you got multiple groups. There's like 6 or 7 organizations that make these recommendations, and you got multiple organizations with multiple people in them looking at data and trying to come up with, okay, this is what we recommend. And so historically it's been a little controversial about when screening would start. And there's a reason for that, because as much as screenings are an amazing, wonderful thing that people should do, there are downsides to it, right? Because if more people are getting screened, there is the risk that somebody gets a false positive, which means the screening looks at something and says, hey, this is a potential issue, you need to get this checked out, and they end up getting another procedure. So you have to kind of weigh that risk of false positive versus the benefit.
Right.
And so, historically, it'd been kind of older patients that would start getting these screening mammograms, and now the consensus is shifting more towards younger, 40 years old. And we just talked about this, I think, in the last 2 episodes about young people getting cancer. We talked about Kate Middleton, which we still don't know what type of cancer she has, and then the week before we talked about just the overall increasing number of young people. And when I say young with cancer, I mean 40s, or even younger than that, getting cancer these days, which is
I wonder if it's a percentage, not just like just from the technology.
Like we're finding more because we're doing more?
Yeah. I remember whenever I
that's
had Avery, and they were looking at her through those.
The ultrasound?
Yeah, and they were like, oh, we see something. they're like, don't worry though, we've just we see
Right.
things different, like we see new things all the time because this
Yes.
technology is so new. But it scared the crap out of me.
Really? Yeah.
And they sent me to like a specialist to make
Oh,
sure
So
that there was nothing
yeah,
wrong.
and that's a
I was
classic
like,
example of how screening stuff can potentially have a downside, right? I
Yeah.
mean, in your case, I guess it didn't have like a true downside because
Yeah.
nothing bad happened, but it caused you anxiety. You had to go to another doctor.
Yeah.
And so, that's the whole risk-benefit thing when you talk about screening. And fortunately for you, it all turned out great. But
Yeah.
but that's why there's a little bit of controversy regarding these screenings for different cancers.
what does it look like for whenever like you get like your normal yearly women's checkup where they just like touch?
Yeah, so there's
Does that even do anything? I know my doctor's always
It's not
like,
great.
okay, everything feels
Yeah.
good. And
So,
I'm like, cool.
the general consensus for breast screening exams, meaning actual physical exam, I mean it's a little bit controversial because there's a couple things about that. One, you want to diagnose breast cancer early, and when it gets to the point that you can feel the mass, like it's not early.
Yeah.
The advantage of a mammogram is it can pick up breast cancers when it's literally just individual like cell clumps. You would never feel that.
Yeah.
And kind of jumping ahead to just my kind of thoughts on this as a plastic surgeon, people would probably be like, oh, why is a plastic surgeon waiting on breast cancer? Well, I actually see a ton of breast cancer patients because I do reconstruction for breast cancer.
Yeah.
And not only that, like I work with multiple doctors, breast cancer doctors, that are sending me patients. So no, I'm not the one that's actually treating it, but I see breast cancer all the time and have for many, many years while I've been doing this. And so, my thoughts on this is that I think starting at 40 is absolutely a great idea. And I agree with the criticism that this task force, the USPSTF, didn't go to annual because, getting a mammogram, I've never had to get a mammogram myself. I know that it can be uncomfortable for women, but, getting a mammogram overall is a fairly non-invasive test, and it can absolutely save your life.
Yeah, I agree.
Having seen so many women with breast cancer, I fortunately have seen women that, didn't win their fight with breast cancer. And across the board, the women that, have these worse outcomes detected their cancer when it was more advanced.
Yeah.
And a mammogram can absolutely pick these up when they're very, very early. And, as I said, breast cancer is 100% curable when it's caught early, but when it's caught late, it is very problematic. And, and breast cancer is unfortunately very, very prevalent, both in the world and in our society. I think most people have heard the statistic that 1 out of 8 women in their lifetime will have breast cancer. That's like 13%. That's a significant amount. In the United States, outside of skin cancer, breast cancer is the most common cancer diagnosis in women, and it's the second highest cause of cancer mortality for women.
Yeah.
So, you have a cancer that is very prevalent, and you have a cancer that is 100% curable when caught early. To me, the logic is clear. Early screening is good.
Yeah, for sure.
So, and you kind of were talking about some of the risk factors, or we're kind of diving into it. I think a lot of people know the risk factors, but it's definitely worth going over just to kind of solidify it. So, of course, risk factors for breast cancer, being a woman, and that sounds silly, but men can get breast cancer.
Yeah.
It's exceedingly rare, but it does happen.
Why does it happen? Is it
in
just
men?
from why does it happen in females? Is it just from fat tissue is easier
Well,
for
it's
cancer
just
to
that
grow or something?
it's just that the cancer is specific to the cells that make up breast or mammary tissue.
Okay.
And so, most men don't have, when, we in the womb delineate between man and woman,
Yeah.
the mammary glands typically don't develop in men.
Yeah.
And so they don't have those cells that are the ones that actually get the cancer. Because the cancer actually arises either in the ducts, basically the tubes
glands.
that bring the
Yeah.
milk out, or the actual lobule where the milk's produced.
Yeah.
And so, if men don't have those, they're not going to get cancer. Same way, testicular cancer is rare in women.
Yeah.
Can it, potentially happen if there's, some sort of issue in the, gestation period?
Yeah.
You do get people that have, characteristics of men and women. Yeah, sure, it can happen, but it's, exceedingly rare.
I'm pretty sure breastfeeding diminishes your chances of getting.
You're very smart. You're absolutely right. So risk factors, I'm going to say that one. Yeah, that's exactly right. So risk factors, being a woman, number one, age, even though we talk about the fact that breast cancer is happening more frequently in young women, age is a factor. The older you get, the more your risk goes up.
Sure.
You said one that's very important, family history. If you have a strong family history of people getting breast cancer, also the age they get it is important. Then that's a risk factor. Genetics, we've talked about BRCA in the past. BRCA is basically a acronym for a genetic issue with how our bodies deal with cancer cells or cell repair. And so, people with BRCA are much, much higher risk.
I think Angelina Jolie had
Angelina Jolie was BRCA positive.
She got hers.
Yeah, so if you're BRCA positive, like the right thing to do is to get a prophylactic mastectomy. Because unfortunately with BRCA patients, their risk of breast cancer is extremely high of getting at a young age and extremely aggressive cancers. So absolutely BRCA patients should consider prophylactic mastectomies. Personal history, if you had a breast cancer once and you got it taken care of, your risk of breast cancer is much higher moving forward. That's why so many people opt for mastectomy versus just taking the little individual lump of cancer out.
Yeah.
Early menstruation, so we're getting kind of some of the things you talked about. If you have early menstruation younger than 12, it's a higher risk. Late menopause. Okay. So if you go through menopause after 55, that's a higher risk. No children or breastfeeding. That's the one you were talking about. History of hormone replacement therapy. Alcohol use, strong alcohol use, and obesity are also higher risks. Which, you wonder why more women are getting at a younger age. If you look at the data, like we are as a society, drinking quite a bit and also...
And not having children till later.
That's true. That's also true. And then also we're, as a whole, heavier than we used to be.
For sure.
The rate of obesity is going up.
Eating all those processed things.
I know, going up steadily. And so I think that might be one of the reasons because, it's like, okay, well, if the rate of obesity, goes up 20% over 10 years, I mean, that is adding a risk factor to those cancers where it is a risk.
Yeah.
So, but yeah, I thought this was a good update to the breast cancer recommendations. And like I said, I don't treat cancer personally, but I have so many patients that are going through it because of the fact that I do breast reconstruction. And, the one thing I've found is that breast cancer is absolutely curable, but you have to catch it early.
Yeah.
And how do you catch it early? It's not by doing breast exams. I mean, that is a good thing. So I'm not at all telling people not to do self-breast exams because better late than never, right? I mean, if you haven't got your mammograms at all and you catch a cancer when you can just barely feel it, that's better than letting it grow very large because your treatment's going to be easier. But mammograms are key. I mean, they pick up cancers when they're very, very early, and those are the cancers that can be cured. So,
yeah.
So I think this is a good update. And like I said, I do believe that women should get them annually. And I'm not alone. There's a lot of people that think that.
Yeah, I don't see why not.
Yeah, I know.
How often do you get colonoscopies and stuff like that?
That's every 5 to 10.
I hope so.
I just got one, so I think I'm good for a while. I know I'm getting old, man. I'm getting up into the age where I'm having to do these cancer screenings. I guess what do they say? Get old or die. I guess I'll always take get old over dying.
Yeah.
So, but yeah. So important information. I think that it's a good thing that they updated this, and hopefully it will mean more people are cured of breast cancer. Because I was looking at the data, I think it's close to 50,000 women a year die from breast cancer in the United States. It's a significant number. So
it's a lot.